Good evening all. I'm Aditi Lamba with the Wednesday night edition of South Asia News, Vision of Asia. We are coming to you from our studio in New York City. Welcome to the show. Let's begin the episode taking a look at the coronavirus pandemic and its impact. The world has surpassed 168 million cases of COVID-19 with now more than 3 million deaths. India, home to many of our viewers, has now surpassed 27 million cases of COVID-19 with 300,000 deaths. India also recorded more than 4,000 COVID-19 deaths just today. The country is still struggling with lack of PPE, oxygen and other supplies, and hospitals still continue to be overwhelmed. The disease has now reached rural India and is spreading. Here in the United States, we are at more than 33 million COVID-19 cases with at least 591,000 deaths. Cases and deaths are currently down across the nation, with now at least 50% of the adult population fully vaccinated against the coronavirus. Meanwhile, today in San Jose, California, at least 8 victims were killed during a shooting. The shooter is dead and the investigation is going on, with officials yet to release a possible motive. Our condolences to all the families and friends of the victims of this mass shooting. With that, let's now begin tonight's South Asian News segment. Here are the headlines. Vibha raises $1.8 million for COVID relief in India, featuring Michelin-Star chef Vikas, Khanna, New York. US reaches 50% fully vaccinated adult, Dr. Mishal, Reja, New York. Northeast United States Carrom Association hosts Carrom Tournament 2021, New Jersey. It's time for a short break. Stay with us on Vision of Asia, Voice of the Community. We'll be right back. Welcome back. I'm Aditi Lamba and this is Vision of Asia, Wednesday night episode of South Asian News. Let's begin by taking a look at the coronavirus updates and measures. Daily coronavirus cases continue to trend downwards in most states, and deaths are also down in the country. The United States has reached 50% fully vaccinated adults in its effort to curb the COVID-19 disease. 10 states in the nation have reached a milestone of 70% fully vaccinated adult population, including our neighboring states New Jersey, Connecticut, and Pennsylvania. Looking at the entire population, including now children getting vaccinated, we're at nearly 40%. With that, more than 359 million vaccines have been distributed and more than 287 million doses have been administered. Meanwhile, confusion over the new mask guideline continues to worry public and many experts who aren't sure if they should shed their mask even when fully vaccinated. Reopening of states is also happening all across the nation. So, how should we adopt these new easing COVID-19 regulations and understand a sense of normalcy? We spoke with Dr. Mishal Reja. Here is Dr. Reja. Let's take a look at the United States first. I have some numbers coming in. We are at more than 33 million cases as of now in the country, with at least 591,000 deaths. In the world, we're at 168 million with at least 3.49 million deaths. My question to you is, we keep on hearing that globally and in the United States, the cases are going down and so are the death numbers. But these numbers are so large. So how are you sort of observing it, and how should we sort of analyze this?
The numbers are large, but you know, the nice thing is the worst is behind us. Right now, you know, just as a practicing physician, we see that cases are down 50% from last month and 20% down from last week. Right now, we're admitting 5 times less in the hospital, the number of patients that we were a couple of months ago. So, you know, just from a healthcare standpoint, things have really drastically changed. And in terms of the magnitude of the numbers, look, we've lost a lot of people to COVID. And you know, exactly a year ago, the New York Times published a list of 1,000 names on their front page of all the people who died. And we always remember those who passed on and the families that don't have their loved ones. The magnitude is something that we're going to live with for the rest of our lives. But the nice thing is COVID, it looks like we've turned the corner. It is behind us. The rate that we're vaccinating is really leading this effort.
Right. But, as we talk, Dr. Reja, the world here is opening up. New York has opened up, New Jersey has opened up, Connecticut has opened up. Several other states are also following through the same. My question to you is, we only have half the US adult population vaccinated. We don't even have the children vaccinated yet. Do you think it's a little too early to start opening up everything? And also, I have to get your comments on the new mask guidelines by the CDC, which basically tell you to shed your mask if you're fully vaccinated. How are you looking at all of this? Is it too early?
That's a good question. So first, let's start with the CDC guidelines. Right. So right now, as we know, the CDC says that if you're fully vaccinated, meaning 2 weeks out from your last vaccine dose, you don't need a mask, whether it's indoors or outdoors or around vaccinated or unvaccinated people. And as a healthcare professional and a person who looked at the science and the data, they are extremely accurate and right on in their recommendations. So their data is based off of an Israeli population with a max vaccination protocol. And it's also based off of the healthcare providers in the United States who got vaccinations early. And what they saw was that the risk of getting COVID once you're vaccinated is extremely rare. The risk of getting infected, meaning you could get COVID but not be infected, the risk of getting infected is really rare. And the risk of transmission, of giving it to a person, is really, really rare once you're fully vaccinated. So based on those recommendations and based on hard science, they said, hey, we don't need masks. And that's what the science points to. Now, with that said, I understand that the science points to it, but it's causing a lot of fear. Change is extremely hard, especially in light of the fact that we saw so many people die in the United States around the world. So I know people are going to have a tough time with it. But I do want to reinforce that what the CDC also says is that if you are unvaccinated, your risk of getting COVID, your risk of dying from COVID or getting sick from COVID is high. So you still need to put those masks and you still need to socially distance and be careful. Now, in terms of lifting restrictions, back to your first question, the United States, obviously, in New York City and around the US, all the state governments are releasing disposing of their mask mandates. All the stores like, Target and Best Buy and Trader Joe's, right now you can go in and grocery shop without a mask. And according to the science, according to the hard data, if you're fully vaccinated, again, the risk of getting it and transmitting it are so low that it makes sense.
Let's now take a look at the Northeast United States Carrom Association in New Jersey. The association aims to introduce, integrate, and nurture the popular South Asian game of Carrom into every home in the country. Its vision is to popularize the tabletop game in the United States, hosting events, tournaments, and much more, and encouraging Indian Americans to participate in the beloved game. Also, the Northeast United States Carrom Association provides a platform for both amateur and professional Carrom players alike to improve and enhance their Carrom skills. And on that, recently, the association brought together a Carrom tournament at the Mantra restaurant in New Jersey, hosting an in-person event after more than a year of the pandemic. With many excited players, the event was successful in bringing together Carrom lovers, and the singles championship was won by Ranjit Sapre. ITV Gold spoke to him and key organizers of the Carrom tournament. Here is the story.
Hey. Yes, you did it. Yes, you did. Woo! Yeah. Awesome. Thank you. I'd like to thank my dad, my mom. And finally, the winner of Yuska Singles, Ranjit Sapre. Wins the huge amount, $500. And here is the trophy. Wow!
Very happy to be part of the Newscar's Open Carrom tournament. Thanks a lot to Newscar for arranging this. Thanks a lot to ITV Gold for doing the media coverage of this event. I had only heard about it, but it was awesome to witness up close the passion that Newscar has to bring in new talent and new players and give them an opportunity to play with the top players in the US. This in no way was a small tournament. It had all the top players as well as amateur players. What do I say? Great arrangements, lodging for outstation players, amazing food from Mantra restaurants, and safety, COVID related safety taken care, sanitizer everywhere, everyone vaccinated. So overall, such a great arrangement, and we had a great time. Amazing semis and finals. Not just them, we had many other nail-biting matches throughout the tournament. I hope we will have many more such tournaments in the future. Thank you.
As part of this Northeast United States Carrom Association, we have conducted many tournaments in past. We have conducted 2 in-person tournaments and 1 online tournament, which was a huge success. And now we are gathering once again for an in-person tournament after a year and a half. And you know the reason why. Because of the unprecedented situations which we have because of COVID. And we are glad that we are able to gather one more time after the pandemic situation, because we have most of the people over here vaccinated. The association is mainly formed by our president Abul Shakil Beg, and I'm the secretary Arshad Sheikh. We have our Newscar team formed by Oscar, Narayanan, Tejaswi, Viral. We are glad that we have our sponsors who encourage us every time. They are Karim Rayani, Masood, Parivar Delights, Golconda. And a special thanks to Farooq and Oscar and Munaf for donating for this tournament.
Today, May 21st, is a very eventful day. Almost after 1.5 years, we are back here for face-to-face tournaments. USCA could not conduct any tournaments last year due to COVID. Newscar, the North American US Carrom Association, in leadership with Shakil Beg, Arshad, Rao Saab, and the rest of the folks, have done a wonderful job bringing all of us together. This is a wonderful sport that we all love. We are very fortunate to be back playing, and we hope to continue this events going forward.
Hey everybody! Thank you ITV for coming to cover this wonderful event. USCA was formed a couple of years back, and has been conducting tournaments in Northeast New Jersey for the last couple of years. Last year, due to the pandemic, we couldn't host anything, but this year, after these things have settled down, and after all the people have gotten vaccinated here, Shakil Bhai and Arshad have taken the onus on organizing this wonderful event. It's like about 30 odd people showed up, and that's a good start. And a lot of focus will be on this wonderful game of Carrom, and I'm thoroughly enjoying the event so far. There's beautiful boards, beautiful setup, and wonderful and tasty food. Thank you very much for the USCA organizing committee and all the players who have participated for this arrangement. Hopefully we can conduct more tournaments now now that the pandemic situation is settling down. So thanks again ITV for covering this. We need all the patronizing that we can get for this game, so that we can get more people involved with the game and the Carrom community. Thank you very much.
I came to this tournament to participate after a long time after COVID. This tournament has been conducted and it's really good, and since it was only a one-day event, singles and doubles took place on the same day, and it's very exciting to play whole day.
As the president of USCA and vice president of ICF International Carrom Federation, I am all excited to have first in-person tournament of this year 2021. Last year 2020 and this first 6 months of 2021 were washed out because of COVID. All this while we were taking all the measures and we were doing online tournaments to keep Carrom alive. But Northeast United States Carrom Association, with the help of our President Shakil and Secretary Arshad, we are here and we are all excited to have first in-person tournament. We are taking all the care. We are wearing masks, we are using sanitizers, we are keeping nice distance, and we are going to complete this one-day event. I would like to announce that October last week, Halloween week, we are going to celebrate 25th National of United States Carrom Association. So we are all excited and we would like to invite everyone to participate in this tournament that's going to happen in Wayne, New Jersey. And I would like to have continued support from ITV and all our sponsors. I once again thank you everyone for participating in this tournament.
Well, it's now time for another short break on Vision of Asia, Voice of the Community. Stay with us. We'll be right back. And welcome back. I am Diti Lama and this is Vision of Asia South Asian News segment. India has surpassed 27 million COVID-19 cases with now more than 311,000 deaths. Experts all across predict this case and death toll to be a lot higher than the current figures. The second wave of the coronavirus in India has ravaged the nation, leading to an overwhelmed hospital system crisis with lack of oxygen, PPE, ventilators, and beds. So, well-known non-profit Vibha is now engaged in providing and mobilizing assistance to save lives, stop the spread, and meet urgent health needs of people in India. To date, Vibha, which is based out of the US, has raised more than $1.8 million for pandemic relief efforts and has sent a lot of supplies, including oxygen concentrators, to India. Joining this effort of Vibha and partnering up with them, this non-profit, is Michelin-Star chef Vikas Khanna, who is also a filmmaker, an author, and a humanitarian. Chef Khanna fed 50 million Indians during the first wave of the coronavirus in India last year under his Feed India initiative, and this time around, he's very proud to have collaborated with Vibha in raising donations to send back critical supplies. We spoke to the Michelin-Star on the initiative of Vibha. Visit Vibha, vibha.org/donate for more information. Here's a conversation with Michelin-Star chef Vikas Khanna. Reflect on what you did with Feed India, and also how come you came into the collaboration with Vibha after that?
So we've been working with Feed India since April 1st last year,
right,
and fed more than 65 million meals. But we continued and we spread more into then later about slippers, sanitary pads, and we kept adding to our Feed India initiative as a movement. But when the crisis hit, which was requirement of more PPE kits, more about oxygen concentrators, more about vaccination centers, at that time I wanted to partner with someone who actually is a doer like Kayur and an organization like Vibha, where there's so many volunteers like myself, and everybody joined hands. And our first meeting itself was so important. It really was something which was very close to my heart. I said, if I'm going to be part of any initiative, every single day we need to have an accountability to people who contribute. Because I was sure that if I'm going to collaborate with someone and we're going to request people to come together, and people will be there, because I work like this, that I like to put everything forward, because it's people's contribution more than financial. It's the contribution of the faith in you.
Right.
And then Vibha was so amazingly transparent, and we talked about the administrative costs, and we talked about saying nothing. We just want to make sure that people get help. And I said, my mission would be that, we raise the funds, we work most diligently of procuring the oxygen concentrators and other help, and we need to get it to the people who need it. From
Right.
hospitals to nursing homes to elderly people's ashrams, and we were totally focused on that. And sometimes what happens is that the visions are so matched that you jump into a relationship.
Right. When you're looking at exactly what's happening on the ground, Chef, we'd like to get some information on what is currently happening on ground, how much help has been sent, and, talking about transparency, how is the money being used, and how does it travel? How is everything working out? How is the program like?
So what you see right now is we procure the oxygen concentrators or any kind of kits or anything. So right now, Kayur we were just discussing about, we have a major inventory in America. We need to find a way to send it to India. We will find our contacts and use all the resources we have. It lands in India. Everything gets documented. We take the help of Vibha volunteers and NDRF. That's India's National Disaster Response Force. These are a group of the most diligent and dedicated people, a government body which I've ever come across in my life. And they come and everything is documented to where what is landing. And which is, for me, this is the most important part. I see a lot of people, at the time of when you're emotionally very high about seeing pain in your motherland, our first reaction is let's contribute. But sometimes we see that the accountability of the foundation or the organizations, when I call them back, because I donate, and when I call them back and I said, what happened to that? Oh, that has been done, but can I get some proofs? What do you mean you don't trust us? And that is something which makes me feel very disheartened, because first of all, it's my very hard-earned money, and I want to see the accountability of that.
Yeah.
And if you see now the video I just posted on Instagram, it's showing you the entire journey from point A to point Z, where it actually reaches out, and it's already. And on vibha.org, you can see every single day updates. Of course, I do that at my social media too. But every single day, you're going to see that $800,000 have been dispersed right now in procuring stuff. And what is the latest update?
Well, this wraps up our show for the night. Please send us your suggestions and get your voices and organizations on our show. Email us on events@itvgold.com or follow us on Facebook handle @itvgold. You can also subscribe to our YouTube channel for free access to many of our popular shows. Thank you for joining us tonight from Queens, New York. This is Vision of Asia, and I am Aditi Lamba. Take care and be well.
Yes.